Changes in cardiac output. In response to proper aerobic training, several adaptations occur in the cardiopulmonary system which lead to a significantly increased aerobic capacity. Resting heart rate decreases in part because the interior dimensions of the ventricles increases. That is, the ventricles can hold more blood, the heart gets larger inside. Since the ventricles can fill with a greater volume of blood during diastole, stroke volume at rest also increases. The same cardiac output can be maintained at a lower heart rate. Because a given intensity of activity requires a given amount of oxygen, the cardiac output at a given intensity, such as rest, is essentially the same whether one is trained or untrained. Since more blood is pumped with each contraction, the heart beats fewer times per minute to achieve the necessary oxygen delivery. This increased efficiency is certainly a benefit to the heart. In response to aerobic training, the stroke volume during exercise also becomes greater. Since a given intensity requires a given amount of oxygen, the heart rate at any given submaximal intensity will be lower following as few as 3 months of regular aerobic exercise. If a given work effort, say a 10-minute mile pace, raised the heart rate to 150 beats per minute before training, then the same work effort after training may raise the heart rate to only 130 beats per minute. In order to get to 150 beats per minute, the trained client will need to exercise at a greater intensity, perhaps an 8-minute mile. Maximum cardiac output is significantly greater following training because of the increase in stroke volume. Maximum heart rate is determined by age, not by state of training. But a greater maximum stroke volume times the same maximum heart rate yields a greater maximal cardiac output. And that's changes in cardiac output. Have a great day.